Chapter 10. Patient-centered care takes on a whole new meaning when there are at least two patients and possibly numerous family members with their own ideas of how labor should go for your patient. You must remember to listen to your patient and their needs and desires, but be respectful of all family members that are present. Managing pain in the labor patient is important, as anxiety and uncontrolled pain can cause labor to stall or slow down. You must believe your patient when they tell you about their pain level. You never decide how much pain your patient is in, they do. It is a different experience for every patient. Women come into labor with different ideas and beliefs. It is always good to ask your patient what they expect and to educate them every step of the way. You should ask if they have a birth plan and place a copy in their chart so all the caregivers have access. Discuss options with them. In the latent phase, dialing up to 3 to 4 centimeters, they're usually happy, excited, and talkative. Not too painful yet. Relaxation and breathing techniques will be used here. GBS positive, remember to get that IV going and administer those antibiotics. Phase 2 is the active phase, dilation from 4 up to 7 to 8 centimeters. Contractions are getting stronger and more frequent. Mom can get a little panicky as pain increases. May ask for pain meds or her epidural at this point. Be sure she does not hyperventilate. Remember what to look for, signs and symptoms of hyperventilation. Have her cup her hands over her mouth and breathe into them. Page 138 at the bottom lists numerous ways to help mom. An amniotomy may be performed at this stage. That is a picture of an amni hook that the doctor uses to break the bag of waters. Be sure the patient is emptying her bladder. In the transition phase, she dials all the way up to 10 centimeters and gets completely effaced. Strong, frequent contractions, mom may feel out of control. She might be irritable. Opioid use at this stage is used cautiously as they can cause the infant to lose their drive to breathe once born if used within an hour of delivery. Encourage the pant blow breathing instead of pushing if mom is not fully dilated and effaced. She may get nauseated, she may vomit, she may have a bowel movement, and her legs may start shaking. Stage 2, remember, is all about delivering the baby. So dilation and effacement is complete. Baby may need to labor down if not at that 0 station or lower. We want the body to do the work. If mom starts to push too early, she can tire out. She may feel more in control at this phase as she can now participate by pushing. A pudendal block can be administered at this point, as an episiotomy may be necessary. Midline and mediolateral incisions can be made if the doctor thinks it's necessary. Does mom have a plan for the cord or the placenta? We need to know now. Cord blood may need to be sent to the lab if mom is O blood type or any negative blood type. What does mom want to do when baby's born? Skin to skin? Remember, we need to dry, warm the baby and perform the APGAR scores. Third stage is delivery of the placenta. We have to check it out. Is it intact? Does the cord have 2 arteries and 1 vein? Oxytocin helps with contracting the uterus so mom does not hemorrhage at this stage. It is always given IV. Remember to massage the fundus if it is not firm. Care of the mom, stage 4. This is a very important stage. There's good stuff going on here. As the nurse, you're going to promote bonding, breast or bottle feeding, skin to skin with dad if mom is too sick or under anesthesia. We're going to be checking mom's lochia, the fundus, and stay with mom for the first hour. Remember REEDA, R-E-E-D-A, for any incision that mom might have. and bubble LE, L-E, for any focused assessment you might need to do. Care of the newborn. Babies can lose heat by evaporation, so we're going to dry them off. They can lose heat by convection, so we're going to place them on mom's warm chest, cover with a blanket and a hat. We might be leaving the cord alone, but we need to make sure that it's not bleeding. It needs to be clamped. We're going to put on the ID tags on the baby and the parents. Some parents are real anxious for the measurements, so we might be measuring and weighing baby at this point. Baby might get some medications in the eyes and thighs. Erythromycin to the eyes and vitamin K in the vastus lateralis. We're going to teach mom and dad about the bulb syringe, safety procedures of the hospital. We're not going to bathe the baby right away, even though they might be kind of cheesy. That is some good stuff, and bathing can stress them out, so we're not going to do that till later. Remember, as the nurse, you're always going to wear gloves until the baby has a bath. What special issues might you deal with if you have a teenager that just gave birth? She might need a lot of encouragement. Non-pharmacological methods. Relaxation using hypnosis. Women report feeling calm and in control with the Dick Reed method. With the Bradley method, relaxation and breathing techniques, use of a partner to maintain calm and control, which will help reduce the need for meds. Lamaze is all about increasing confidence in the woman. Numerous coping techniques with her coach. Remember the gate control theory of pain. A pleasant sensation such as a massage or effleurage, which is rubbing the belly in a circular motion, can really help block the pain. A spinal is pain med injected, the needle removed. It's fast acting and short-lived. There is a risk of a spinal headache, which is CSF leaking, and they can do a blood patch to correct it. So if your mom tells you she has a headache and none of her pain med is touching it, you have to believe her and you have to get the anesthesiologist back in there. A general is only used in an emergency, and once the general is delivered to mom, we have 5 minutes to get that baby out or it's going to reach the baby. So they generally give that at the last second and get the baby out quick. Students, I want you to read pages 146, 147, and 148 and read about those cultural considerations. Question and answer. Now we're going to prioritize a patient. So I want you guys to really think about this. It might not be your first inclination. So think about who you would want to see first. And there's your answer.